Yeah, hello, good people. This is Dr. Stephen Okoro, your physician and health coach. Today, we are going to discuss complications of untreated peptic ulcer. What will happen to you if indeed you have peptic ulcer and you've not treated it you ignore it for some time? This is in continuation of our previous of our discussion on peptic ulcer. So for you to understand, let's go back to the basics once again. We did say that peptic ulcer is a wound or a sore in the lining of the stomach. Now, the lining of the stomach is supposed to protect the acid that is inside the stomach from burning the other tissues in the stomach. The stomach is the place where food gathers when you eat, and it contains concentrated acid which is needed for digestion of food. Now, that lining is supposed to be intact so that the acid cannot penetrate into the underlying tissues. But in ulcer, the lining has been breached or destroyed so that the acid can begin to leak into the underlying tissues of the stomach. So the question is, what happens when you ignore? In the previous video, we talked about the symptoms of ulcer. And we did say that when you have these symptoms, you have to seek medical attention. You don't just be taking Gelusil or Antacid thinking that will solve the problem. You need to seek medical attention so that the proper investigation and diagnosis will be made, so that if you have ulcer, it will be properly treated. But where you ignore it, what are the symptoms? The common symptom that we will notice is the symptom of bleeding. Because that wound that is open, there is an accompanying loss of blood. Whenever you have a cut, blood leaks out. So if you have peptic ulcer, which has been there and unattended, blood will be leaking out from it slowly but surely. It may be leaking out slowly, in small quantities, so that you may not notice any symptom. But with time, you begin to notice symptoms of anemia. Symptoms that will show you that anemia is developing. You may start feeling weak or tired all the time. You start having frequent tiredness. You may touch your feet or hands. You'll be feeling cold, having cold hands and feet. As somebody looks at you, your eyes may be pale. They start noticing that you are not as bright as you used to be, because it shows that the blood, your body is losing blood gradually. And sometimes you find yourself not being able to engage in those activities that you normally engage in. Maybe if you want to run or even play with your friends, you find yourself having shortness of breath. So these symptoms of anemia, they show that you are losing blood and you need to do something about it. Sometimes you see yourself, you're getting, sick more often than before. So it could be that you're losing blood and your body's immunity is going down, and you have to do something about it. Now, when the ulcer has advanced, if you didn't do something when it was small, definitely that peptic ulcer will get worse, and we begin to have complications that accompany a severe peptic ulcer. And one of the symptoms or complications that will tell us that it's advancing is the fact that the bleeding gets more obvious. It becomes obvious. And how do we know? Your stool becomes black, what we call melena stool. It becomes black and tarry like coal tar. Or you see yourself vomiting things that look like coffee granules. When you begin to see such things, it is evidence that you are likely losing larger quantities of blood from peptic ulcer. And then the other complication is outright perforation. By perforation, we mean that that wound may eat completely through the wall of your stomach. And that means that whatever content, both the acid and the food that the stomach is supposed to contain, will now be leaking out into your abdominal cavity, and it will lead to a condition we call acute peritonitis. Peritonitis is an emergency that requires admission in hospital and sometimes surgery. It requires urgent attention. You see yourself vomiting, you can't even go to toilet properly, you're vomiting all the time, losing blood, losing water, all kinds of things. You'll be very sick. So it's an emergency. It's an evidence. It's a sign that you're having perforated peptic ulcer. Now, the other complication is obstruction, what we call gastric outlet obstruction. Now, gastric outlet obstruction usually happens because the ulcer may be located, especially the one we call duodenal ulcer, even the gastric ulcer that is located very close to the exit of food from the stomach. The ulcer may happen there, and then the inflammation and the scar tissue that will form around there can narrow the passage of food outside the stomach. So the food that's supposed to pass into your intestine may not be able to pass through that tiny hole any longer. So you see that when you now eat, the food will now, instead of going forward, will now back up, and the person will vomit. When you see yourself vomiting shortly after eating, you're having abdominal pain and you vomit, and then you feel better, and it continues like that. It is a sign that you are having gastric outlet obstruction, and it requires serious attention. You don't have to ignore it. And because the person is eating and the food is not entering into the intestine for proper digestion and absorption, the person will be losing nutrients and will be looking malnourished with time. So that is a sign that the ulcer is complicated by gastric outlet obstruction. Now, a very serious complication of an ulcer that has not been treated over a period of time is stomach cancer, or what we call gastric cancer. It can lead to cancer. The tissues around the ulcer area may start dividing in a very uncontrolled manner, and then giving rise to a tumor inside the stomach. And when somebody is having cancer, you don't want to wish that for even your enemy. It is a very serious condition. The person is losing weight, looking very sick, and that will actually require long periods of treatment and management and all kinds of things that will be happening in the hospital. So, and one thing about cancer is that people with H. pylori infection have increased risk of stomach cancer. It is more probable for somebody who has untreated H. pylori infection and who eventually developed peptic ulcer from it. The person has an increased risk of developing gastric cancer or stomach cancer than somebody who didn't have that infection, or whose infection has been treated. So that is the more reason why you have to seek early medical attention, so that you don't have any of these complications. The good news is that early intervention prevents these complications from arising, and once you are treated, you'll be okay. So that is why it is said prevention is better than cure. So in our next video, we are going to talk about how to diagnose peptic ulcer. When somebody has these symptoms and you get to the hospital, we are going to discuss how the doctor will be able to diagnose it and to tell you that, okay, it is there or it is not there. And if it is there, what treatments are available. So I want you to stick with us. If you have received adequate value from this video, please do not forget to share, like this page, and equally subscribe so that you'll be getting more of our videos. So thank you very much for your time. We wish to be of more use to more people, and thank you once again. Bye-bye.